Okay, it's Dr. Buford, we're just getting started on this left knee. We're looking in the medial compartment first. And so as we look here, we'll go through the anatomy with you. This is the medial meniscus that we're going to point out in just a second here. So first step, we're just using that suction on that shaver instrument that you see there. Meniscus looks like it's in good shape. The cartilage above looks good. Maybe some minimal fraying right in here. But as you can see, pretty easily handled with our shaver. Don't even need a pair of scissors for that. And now we'll go off on the video and show you some more in just a minute. Okay, so this is the central part of the knee. That's your anterior cruciate ligament just behind the shaver here running up. So far so good. No signs of any tearing there. There's a little bit of bleeding. That'll stop in just a minute. Your posterior cruciate ligament inserts on the femur just to the left of that shaver, and that looks good also. So the next step is to go ahead and start to get a look at this lateral compartment where we think most of the pathology is. We'll go off on the video in just a minute. Table down just a little. Okay, so this is the lateral compartment, and it's not hard to see all the damage to this meniscus here. See all these torn things. And we'll have to see how much of this is fixable once we get out the parts that are not. So some of this is already kind of taking care of itself, as you see here. In fact, I don't know that we can do anything else to the meniscus at this point. Posterior horn back here looks pretty good, so that's the main part we were worried about. This is already torn and there's really nothing left to repair there. And then here anteriorly, same story. And so now we have a pretty good look. So I don't think we have to do a meniscus repair. As far as the condylar defect, that's going to be right up here, and that's what we're going to look at next. But we can see there that that's where we're thinking about putting in that plug. The normal cartilage over here is nice and smooth, but over here on this lateral side, you've got this area where you've lost all the cartilage. So before we make any decisions there, we're going to look around the rest of the knee, particularly in the gutters and in the suprapatellar pouch, to make sure there's no loose bodies. Okay, so this is the patella at the top of the screen. It is actually in pretty good shape. The trochlea has a little bit of roughness to it, see right in here? But I don't think we have to do much for that. That's often an appearance that we are able to successfully treat with an office-based injection and not surgery. So I think this will be okay. There weren't any other significant loose bodies. There were some small pieces of cartilage, but nothing else significant. And I don't see any other defects on the patella. So we're going to go ahead and try and get back down and have a look at this lateral side here. Table up, please. And we'll show you some more in just a minute. Okay, so what we're looking at here is a 10 millimeter spacer, and you can see it actually fits pretty nicely right here. There's a little bit of a gap at the top, very little bit at the bottom, but it covers at least 90% of that defect, so I'm happy with that, and it looks like we can get things pretty flush like that. So that's what we're going to go with. Just wanted to show you how we check our size and our orientation here. I think that looks pretty good right there. Okay, so we've got the plug in, and you can see, let me get to where I can show you the depth. It's pretty much matched up right with the articular cartilage. So I'm happy with that. There's the normal, there's the plug, and you can see there's really not much room around it. So we're going to finish up here and get you back to the recovery room shortly. I really hope this does the trick for you, okay? So good luck to you now. Bye-bye.